Welcome back, everybody, to the next episode of How to Get Away with Staffing. My name's Colin LeBeau, president at Foxhire, employer of record service here in the U.S., and I've got our director of operations and healthcare services, Jamie Henry, with me today. We're going to talk about how to build a back office for healthcare staffing, which is a little bit different than traditional staffing, wouldn't you say, Jamie?
No, it's absolutely different. Yes, definitely a little more complicated, um, but something that can easily be managed with just some thought and effort ahead of time to make sure you're set up appropriately to account for everything.
Yeah. Yeah, I think there's a lot more on the line, is what I would say. There's a lot more on the line, a lot more risk involved in the healthcare staffing back office comparative to just a regular, let's just call it admin staffing back office, that you need to make sure you've got your bases covered for to prevent any, um, bad things happening like fines or putting your employees at risk, workers' comp things, injuries, etc. So
That's right. It's
definitely
all
want to
those
make sure you have.
compliance pieces. Yep.
Yeah, exactly. You definitely want to make sure you have all your compliance stuff in check before you start offering healthcare staffing. Unfortunately, that's not always the case. So if you're watching this and you're not set up and you feel like you've got some gaps, definitely reach out. I'm happy to help talk about some of these things. But yeah, I think the place that stuck out to me to sort of start is we just want to talk about how is the back office different. And if you think about it from a chronological perspective, the first thing you might do when you get a staffing arrangement in place and make a placement, you might start onboarding somebody, onboarding a candidate. So what's the onboarding and credentialing experience, and how's that different from just a traditional staffing firm?
Yeah, that's a great question. So really, the credentialing should come first, right? So I think one of the biggest missteps we see is because timelines are so tight, right? Your clients want these employees last week, not 2 weeks from now, right? So we do see a lot of people moving through that onboarding phase while they are credentialing. The reality is the credentialing should come first as a part of ensuring that you have the right candidate for the job, right? Because in healthcare, there's so much that goes into credentialing. So you have the licensing piece. And I think that's something we're all familiar with. We've been expected to verify licenses for an extended period of time now, right? So that's nothing new. So you're going to do a primary source verification on that license. But the second piece of that we often see get missed, but we're starting to have clients ask for it more and more, is the reconciliation. And that's where you are making sure that the license isn't just in good standing. That's the verification, right? You make sure that RN license is in good standing, or LPN, CNA, respiratory therapist, you name it. Reconciliation is where you prove ownership. So that's where you're making sure that the candidate presenting that license actually owns that license. And there's various different methods of doing it, right? So nursing is a little more sophisticated than the other disciplines because they've been doing it longer. So there are ways of doing it where you can verify through nurses. At an enterprise level, you can verify the license against the social and date of birth to ensure that it belongs to the candidate. For the areas that don't have those options yet, so respiratory therapy, PT, OT, speech, all those other areas, typically those individuals should be able to provide a paper copy of their license that should be, have the state that it was issued from, some sort of state seal, date of original issue, and date of expiration, all on that one document. So that's the licensing piece, which I think we've all been used to. The piece that's been added in the past few years and that we're starting to see more client requests for is the verification of their education. So wanting to have confirmation that the candidate completed the appropriate education. And in some instances, we're even seeing requirements for they won't accept candidates from certain institutions. And that's because of all the fraud we've seen recently with degrees. So something very important to know, like, what is your client's criteria? Are they willing to accept a candidate, with any educational background, or does it have to be, are there exclusions of areas that certain institutions they won't accept?
Yeah, there were schools that I think had some issues like that, maybe in Florida, maybe a couple years
Correct.
ago.
Yep, there were several. And so there still unfortunately is some ongoing restriction on individuals that had degrees from those institutions that have been licensed. So you may check and see a license, but it may not mean that that individual is eligible to work. So education is the second piece that we're starting to see more often. And then a third piece, which has really only hit our radar, I would say, in the past 2 years or so, is proof of clinical competency and what they're really looking for. So we've seen in the past requests for, various different assessments that can be done online and things of that nature, but we're starting to see that replaced with wanting clinical references. So unlike just the standard reference check, this is where you're actually doing a reference check and trying to verify clinical competency with a contact at a past employer that would have been witness to that employee's level of skill in a certain area. So that's all become part of that kind of credentialing process that we're starting to see. There's also the standards, right? There's things that have been around for a long time. So skills checklists are a big one. So wanting to see that the person has, completed certain skills checklists or has various different like standard certifications. So we see a lot of, BLS, ACLS, PALS, depending on the area they're working in. So various different certifications that apply to either working with pediatrics or in the emergency department or whatever that specific area of focus would be for the role that you're looking to fill. So that's more that credentialing piece.
Wow. Yeah, there's a lot there.
There's a lot there. Yeah, and there can be even more than just what we've discussed. Again, it's very client specific. So it's important, to know your client. You could take certain pieces of that and start to build up a pool of candidates, but know that even with a pool of candidates that you feel that you've vetted and credentialed, it's important to know if the client has additional criteria that they're looking for as well
Gotcha.
for that credentialing piece. So
Yeah.
you'll see a lot of like various different state checks, right? So you see the standard background check, but if you're working in with a vulnerable population, whether it's pediatrics or geriatrics, we're going to see that level 2 background check a lot of the time. So it's going to be the actual fingerprinting that they want in addition to that standard county, state, federal criminal check that we typically do, right? We'll also see like depending on the state, there's different state-based background checks that they want run as well. So again, it's important to know what exactly is that client looking for that you might want to add to a candidate that you've already credentialed to have in your pool ready for placement. So that's kind of credentialing in a nutshell. And then there's onboarding. So onboarding is what we would be doing when we're looking to specifically, place that candidate at a site. So, every client's going to, again, have slightly different criteria there. What are they looking for in terms of their occupational health records? Do they have specific requirements for their drug screening? Do they require, some clients will let you waive certain immunizations and others won't, right? So some are going to say you have to have that hepatitis B. Others are going to permit a declination form. So it's just important to make sure you know exactly what the client wants when you're setting up those screenings or record collections for those employees.
Yeah. I mean, there's got to be at least 15, 20 pieces sometimes when you have new onboards for healthcare. What would you say the average number of items needed to be gathered is for a normal placement in healthcare?
Yeah, that 10 to 15 is spot on. And it's
Okay.
going to be even more than that if we're dealing with like an MSP. So if we get an MSP or a VMS in there, we're starting to see more and more, right? Like even things like the respirator fit test or a pre-employment physical, just some additional requirements that, are newer within the past few years, but becoming more and more frequently required as a part of onboarding, as a responsibility of the agency, not the host employer.
Right. Wow. Yeah, that's a lot more than a normal back office need is for IT or admin, right? Like 5 maybe.
Yeah, it's a lot of additional time. So your onboarding timeline is going to be longer, right? Because you
Right.
have to get all of those things accounted for. The other piece is it's a lot of additional cost. So you want to take that into account when you're thinking about how you set your bill rates, right, with these clients, because you're going to have a lot of upfront costs, some of which, if the candidate doesn't work out, unfortunately, you're not going to see any return on that.
Yeah, that would be unfortunate, but happens a lot, right? In the healthcare
It
staffing
does.
industry. How are staffing firms or EORs managing this credentialing process? Like, what are some of the options you might have if you're like, I need to figure this out? How could I go about attacking this? Because I know there's a few different methods that people employ.
Yeah, there are. So, I mean, there are services, right? There's services that you can pay to do this on your behalf. Obviously, there's always going to be a markup in there, right? So it's already an expensive process, and that kind of can add some cost to it. We also see some agencies, have their own internal team that has training in the area to make sure that they're doing it appropriately, right? Because these the host employer is typically going to be a hospital or a clinic or something of that nature that is likely to be audited at some point, and your records for your contingent worker are actually part of their audit. So, we have a responsibility to make sure that they're complete, that they're accurate, and that they meet the client standard or the standard of the state, et cetera, depending on the role. So, it is really important to make sure that whoever is overseeing that process, whether you've outsourced it or whether you're doing it internally, that they have the appropriate, skill and knowledge to be doing that. And then whatever fashion it's being done in, that those records are being saved in a way that's, organized and accessible, because oftentimes in the event of an audit, you are expected to present records for your contingent workers back to a certain date, typically same business day. Sometimes you get 24 to 48 hours, but oftentimes it's,
Wow.
the request comes and they want them now. So, making sure they're organized, well labeled is really important.
Yeah, this is where
Um,
the compliance comes in. You got to be compliant,
that's
and you got
right.
to be able to be compliant when it's important.
That's right.
A lot of that's time bound.
Yep. Yep. And the challenge too, I think, is that we're seeing a high level of variation on what can be requested depending on who it is that's doing the audit, right? Is this a joint commission audit? Is it OSHA? Is it one of the state licensing agencies? Who's asking for the records and what specifically do they want? So having those accessible in a way that you're sharing what should be shared on that employee without sharing confidential information is really important. So having that well organized matters.
There's a lot of agencies that have an interest in the healthcare staffing space for a number of reasons. So it's not just one group that wants to see what you're doing. So
That's
absolutely.
right.
So we just talked a little bit about time-bound things, and one of the things that I think differs in the healthcare space is time and attendance, and there's sort of two components to that. So thought we might talk about scheduling people and then accounting for that time. How might that differ from just a normal staffing firm that does admin or IT or something like that?
Yeah, absolutely. So, the big thing with healthcare is so much of the work is driven by what's known as census and acuity, right? So, how many patients, how sick are they, right? If you're talking about like an inpatient setting, outpatient settings vary a little bit, but they're going to have similar contributing factors, so patient loads, et cetera. So, unlike other areas where work might be able to be pushed a day or two, not so easy to do in healthcare. So those numbers really matter. And they're typically trying to stick to some pretty strict scheduling criteria as far as how many, nurses or therapists or et cetera that you need on with a certain skill set for a certain day. So, schedules aren't going to be quite as flexible for your contingent worker. They're going to want them scheduled at certain days and certain times, and they're going to need to be able to see that schedule, right? So, most of our clients want the contingent worker scheduling in their system where they can see that schedule. So, we see some variety in how that's managed, whether it is, through a VMS, which is a very common option. We see a lot of that. Some also, still do paper scheduling. And so that paper is going back and forth by email, which is very time consuming, but it's really important to be responding in a timely fashion to that because that client's banking on those numbers. They need those numbers for planning purposes. So the scheduling piece is a lot of variation as far as how that's managed. But the one thing that doesn't tend to change is that it's not real flexible. So once that schedule is set, they're expecting that worker to be there, so much so that we're seeing an increase in the number of clients who are applying penalties for
Right.
canceled shifts. So,
Yeah, paper timesheets, paper schedules, very time consuming, not super scalable, but unfortunately very common in a lot of
yeah.
instances. So definitely want to be prepared for that. Are there any tools that staffing firms can sign up for to manage the schedules for their staff that you're aware of?
There are a lot of different software options that we do see different agencies use to try to handle that schedule. It I think the hardest part is finding something that integrates well with the client. So regardless of the option picked, if it's not the clients, you're typically still going to have that duplication, right? Where you're, either a specific contact at the staffing agency is going to be responsible for that and managing that, or each of the contingent workers is going to be updating in both systems in order to make sure that that information is visible for both
Yeah.
parties.
Yeah, clients are thinking about it. You're thinking about it, not just scheduling, but a number of different systems that you try to work with. So if you're the vendor, you've got to work with whatever the client says that you need to work with if you want to work with
Right.
them.
That's right. That's right. The flexibility is going to be expected on the part of the vendor, not the part of the client,
Yeah,
right?
exactly.
So, yeah. And another part of scheduling too that I think often isn't really thought about until it happens is that, obviously staffing is one of the most expensive parts of running any sort of healthcare organization, right? A lot of their cost is in their staff. So when
Yep.
numbers can be reduced, oftentimes it's going to be your contingent worker who's going to be the first to have a shift canceled. So census drops, acuity drops. They don't have as many call offs as they anticipated for that day, and they have more workers than they need. They're going to start sending people home or canceling shifts. And oftentimes that contingent worker has the highest quote unquote, cost per hour
Right.
of the employees, and they will be the first to be canceled. And most of the contracts we see don't have a guarantee for payment for those canceled shifts. So, the worker isn't paid for those hours, even though they were scheduled, or they may be paid for. A lot of times, what we'll see is 2 hours, right? The first 2 hours are guaranteed pay, but not the remainder of the shift.
Yep. Yeah, they don't usually like to make that go both ways. They'll penalize you, but if they cancel on you, they're not necessarily super willing to pay you some type of fee. So
That's right. And a lot of times they still keep that worker sort of on the hook for the rest of that shift. So while they've been canceled and sent home, they maintain the right to call them back. So it's
right.
not even as though the worker can then go, pick up a PRN shift elsewhere, or something. You can't move them to a different location because they may be needed back at that client site.
Yep. Yeah, there's a lot of things to consider, and you don't want to have an upset group of contractors either. So you got to manage that well. So that's sort of like upfront scheduling, prior to people working. Then you got people working, right? And then after they work, you got to pay them. So that's where like timesheets and payroll come in. And there's a lot of things to consider timesheets and payroll for a healthcare environment that is totally different than somebody working in an office. So what are some of the things that come to mind for you, Jamie, when it comes to timesheets and payroll in healthcare that are different?
Yeah, absolutely. So that's been one of, I would say the biggest areas of focus for Foxhire that's really helped us to, again, like we just discussed, flex to the client's need, right? So, it's one of the ways that we've made ourselves a better fit for covering their staffing needs is that we can cover things like on call, callback, shift differential. You'll even see like incentive pay that's added for specific shifts or for picking up X number of hours. And so being able to apply those specific types of pay to individuals and being able to vary that even across individuals within an organization is huge, right? Because you may offer a different shift differential for, say, your ICU staff or your float staff than you would for your med surge staff. And so the more flexibility you can offer in those situations, the better. But because you have all those different types of rates and all of those variations that you can see, you also have to be able to handle the compliance side of it, which would be like a weighted overtime average, for example. So, per the FLSA, overtime has to be inclusive of all rates paid to that individual for that time period. So if they made different rates depending on whether they were covering, say, the again, that med surge unit, or they got paid a higher rate when they were floated to critical care, which is common. You do see that sometimes, or because they worked an evening shift and then a night shift. So there was a shift differential that they had to account for. Your overtime has to account for the differences in those rates.
Yep.
It's not just a blend of all the hours added together. So we do have, calculations built into our timekeeping. You could do those things manually, but it's a lot of work and
A
there's a
lot of
lot
math.
of potential. It's a lot of potential for error, right?
Yeah.
No matter how good you are with math or how good you are with Excel, it's challenging. So, having a tool that will reliably handle weighted overtime average is really important too. Um,
And
and
the
then there's
overtime rules just changed, did they not? Department of Labor Department of Labor, yeah, they just issued a new change to overtime, double time, what qualifies for hourly versus salary rule.
Right. And that's just one example, right? Like we see these things roll out all the time. And so you do really have to stay on top of it. And watching by state, right? Because while most healthcare roles aren't necessarily going to be impacted by minimum wage, what we see a lot of these clients doing is trying to consolidate services through one vendor when possible. So you may be covering everything from housekeeping staff all the way through, a CRNA or above. So you may have staff that you have to look at those minimum wage laws, which we know change on a regular basis, right? And so there's a lot to track there, especially if you're going to cover across multiple different states.
Yeah, the different states thing is a completely different story as well, because it's going to differ. There's going to be a lot of things that are just one off for one state that don't exist in the other state. So
Yes.
if you're doing
Yeah.
multiple states, that's just multiply everything we're talking about by 2 or 5 or however many states you're in, because it's going to be different.
Yeah, absolutely.
What's the prevalence of daily pay though? That's also one of the things I thought was interesting. Daily pay is getting pretty common in the healthcare space.
Yeah, so it is, but there's something really important to qualify there. So daily pay, we are seeing a lot about daily pay in the headlines in a negative way.
Yeah,
When
yeah,
you're using daily pay to refer to paying a flat rate for a full day of work. So highly frowned upon, right? That in a lot of situations will get you into trouble as far as those overtime laws. So a lot of healthcare roles don't end up qualifying for daily pay, need to be structured as hourly, right? But those employees want to be paid for each day that they work. So
right.
rather than working, Sunday to Saturday and then getting paid the following Friday, there is this increased demand for, well, I finished my shift today, I want to get paid tonight or first thing tomorrow, which is actually a little more common, that the daily pay is actually the next day, right? And so oftentimes it's set up by way of a pay card, and the employee works the shift. The shift is approved by the supervisor at the host employer site, and the employee is then paid to that paid card or that pay card the following day. And then any overtime that accumulates for the week is typically caught up with like that last pay at the end of the week or a supplemental pay at the end of the week to
Right.
cover any overtime that accumulated during that week.
Yeah, it gives the employer the ability to manage the pay card instead of sending the money out to the bank account. And if you did overpay, you really can't take that back, right? And so it gives a little bit more control and
It's a
enables
good
the
point.
daily pay to happen better,
Yeah.
Definitely a thing to consider if you're trying to do like PRN or like per diem shift work. A lot of those nurses want to be paid instantly. So having
Yeah.
that
Huge employee
capability,
satisfier for sure. Yeah.
no
Yep.
doubt.
We are definitely seeing an increased request for that.
Yeah, but it's hard to do that if you don't have an approved timesheet and you don't have, responsiveness from your clients, especially if there's an MSP VMS involved, because then there's way more extended timelines. So navigating that can be difficult.
Absolutely. And you bring up a really good point there, Colin, that I think a lot of times, agencies aren't necessarily aware of. And that is that if you contract with that employee for daily pay, per the FLSA, you can't put a requirement in there about like approved timesheet.
Right,
So,
right.
our level of comfort, obviously, we'd always love to have our client approve it before we pay
Of
it.
course.
But the reality is, we're on the hook for the employee first. So that employee
Yeah.
is expected to be paid with the thought process of anything that doesn't get approved or were to be rejected for any reason, you go back and try to correct that retroactively with the employee, which anybody who's done that knows more often than not, it's not successful. And
People
it's
are not very
certainly,
inclined to give
yeah,
you money back.
no, it definitely doesn't contribute to positive employee relations, right? But that's the risk you take. So with daily pay, there is something more of a risk for that because you are, if that employee worked Sunday and expects to get paid Monday, if that approver doesn't approve, you still have to pay them on Monday. And then you just have to keep working on getting things straightened out with the approver after.
Yep. Yeah, that can be a fun process.
Yeah.
A lot of the stuff we're talking about as far as the compliance and regulation, things that you have to do, mandatory processes are influenced by some different agencies, different laws, FLSA, all that type of stuff. But there's like a new entrant to the compliance arena in the healthcare space that I think not a lot of healthcare staffing agencies and EORs and all the in-betweens are really taking heed of. And I think it's important that we start to talk about it, because if you don't, there will be a day when these are going to be more and more enforced. And if you don't have healthcare staffing licenses, state by state healthcare staffing licenses, you're going to be in trouble. And there are hundreds, if not thousands, of staffing firms and EORs that are operating unlicensed right now. And those are
Right.
all putting themselves at risk or putting their clients at risk under these licensing requirements that they're not complying with at the moment. So thought we'd bring up the healthcare staffing licenses. These are state level licenses that we're referring to, and they're relatively new in the last like 24 months, right, Jamie? Like, when did these start to come about?
Yeah, no, definitely a significant increase in the number of states, we'll call them either licenses or registrations. They operate the same way, regardless of the term applied. Um, in the past 2 years, we have seen 14 additional states add requirements. And of the 9 that had them prior to that time, the majority of those 9 have gone back and significantly increased their requirements, whether it be, the fees have greatly increased. But on top of that, regular reporting requirements, vetting of the agency, background checks, et cetera, things like that for, the director level and above at most of those agencies as well. So much more stringent requirements to renew or obtain licensure or registration, and then to maintain it as well.
Yeah. So how long does it typically take to acquire some of these? Like, let's say I wanted to get licensed in my home state, right? Whatever that state might be. How long might it take me to do that?
So there's 2 parts to that. There is the actual act of going through the steps to complete the registration process, registration or licensure process. We happen to have a phenomenal team that moves that process quite quickly. And I think the longest it's taken us to get through any state application, to include background checks of our officers, at this point is probably about 1 to 2 weeks maximum. However, once it's in the state's hands, we have a couple states in particular. We have some
Yeah.
states that we've been sitting waiting for approval of that registration since late fall of 2023. And our understanding through our contacts at ASA is that's the norm for the majority of agencies. Now, here's the good news though. If you have completed that registration process, most of those states will give you in writing a statement that says you can continue to conduct business while your registration is under review. So, we do, like, for example, New York and Kentucky. That's our situation in both of those states right now. So we have documentation from the state saying, go ahead, business as usual. You can continue making healthcare placements while your registration is being confirmed.
Right. And that's going to have to be the case in the states that issue new license requirements like New York and Kentucky, that everybody's responding to that and they're sort of giving some grace there, right? But there's also some states that have license requirements for quite a few years now, no?
There are, and those are different. So it's not been the same response there. So, like Massachusetts, for example, we were not licensed in Massachusetts until about a year and a half ago, and that was due to some requirements for physical location that we were working on the state with. And the state was very clear that until we were registered, we were not to be conducting healthcare business in that state, that any placements we did make would be subject to fines. And they're typically, I can't remember Massachusetts off the top of my head, but like I know Illinois, for example, for a violation, it's $1,500 per day per incident is what they claim they can, fine you for. And probably more importantly, they will halt business on the spot if you're caught operating without an appropriate agency license.
Yeah, that's a really important thing to think about. Okay, so I want to talk to people. You're watching this, you're either doing business yourself in any one of these states. There's 24 of them that require licensure. You can check out our website. We have a blog post about this on our website. But you're operating one of those states unlicensed. If your client or if a candidate of yours raises their hand, or in any way the state finds out that that's going on, they can stop you from doing business in that state in total for as long as they want to investigate you, fine you, etc. So if you've got clients that you're serving in those states and you get halted to do business, what's the likelihood you're ever going to get started back up again with those same clients? Because you just left them hanging. Not to mention, you're going to have a bunch of fines or whatever the case may be for your punishment, right?
Right. And, you know, Colin, to your point, those clients, we actually just recently had contact from somebody who they were working with a new recruiter who was intentionally seeking a licensed, you know, firm to supply contingent staff because their firm that they had been using was not licensed, got caught and had to cease operations on the spot. They rely on those contingent staff.
Right.
You know, especially certain sectors, like we know for a fact, the long-term care sector right now, heavily
They
reliant
need
upon
them.
contingent staff, right? So if you have to pause, they're not going to be able to wait while you go get licensed. They're going to find somebody else, and then once that person's there, it's gonna be a little harder to, you know, try to get back in when you've got your license and you're up and running.
Yep. And I think that's even more important for staffing firms that are using employer of record platforms or PEOs, and they expect those organizations to be the compliance arm of their business. They may not even know they need these licenses. And if these EORs, which there are many that are unlicensed, put their business in jeopardy because they're unlicensed and the EOR gets caught, that recruiting firm doesn't have much recourse to try to continue serving those clients because they don't have the infrastructure to get licensed like the EOR does. That's why they hire them.
That's exactly right. Well, and you know, you make an excellent point. So it is really important to know if your EOR or PEO is licensed. And the vast majority of states have a website that you can go check. Now, some of them are a little archaic. You're literally pulling up a spreadsheet and having to, you know, do a search and see if your agency's there. But you can go check and confirm.
It's public record.
You know, that's absolutely right. And so you can look to see who's licensed and who's not. Now, I will say this: if you go to check and you don't see yourself listed on a state, like let me throw Illinois out, for example, we've been licensed there since 2021. So March of 2021 was our initial issue. We still don't show on their website. And we've brought it to their attention, and it's, you know, but we can provide the copy of the license with, you know, the seal from the state, et cetera.
Right.
And if you contact their agency office, they will confirm that we are in fact licensed. So if you're doing your homework and you look for your EOR and don't see them listed, contact the state. Ask the state, contact your EOR, ask them for a copy of their registration or license, and they should be able to produce it on the spot. So we have, and actually, a lot of these states require that the EOR have proof of licensure mounted in the office. Now, most of us these days don't have a physical office to go into and look for, but that tells you that they should have a copy and it should be readily available because even the state expects them to.
Yep. Yeah, 100%. I think it's super important to start talking about. Not a lot of people know what you're talking about. When I maybe bring this up on calls with agencies, it's like, oh yeah, you know, licensure. We can definitely check nurse licensure and we can check. And I'm like, no, wait. It's not about individual practitioner licenses. We're talking about the agency themselves. A lot of people don't get
That's
that
right.
connection.
No, you're right. I mean, I mean, even in our ASA healthcare sector calls, we'll hear some of the agencies, you know, question, well, I don't really understand what's the difference if I'm checking licensure of my app, you know, of my placements, why do I need to do this piece? And again, this is really the state's way of ensuring that anybody's, you know, supplying contingent staff to the healthcare industry is following certain criteria, is not price gouging, et cetera. So, I mean, and depending on how much detail you want to get into, we can talk about the level the states are going to control for some of these things with their reporting requirements, contract requirements, et cetera.
Yeah, well, I mean, if you're building a back office, you got to be prepared to do this reporting. So if I'm a healthcare staffing firm in Illinois, you better be ready to do a bunch of reporting because they want to see your contracts, they want to see your bill rates, they want to see everything.
They do. They actually want to see how many shifts were scheduled, how many shifts were canceled, you know, number of hours. Washington is discussing, they haven't finished their reporting requirement yet. So again, we're seeing this in a lot of states, right?
Increasing the requirements, yeah.
Increasing the requirements,
Make it
right?
harder.
And we just submitted our first report to the state of New York. So even though we're not registered, required to report to the state of New York already, which is this is how they're going to catch people. And it's so specific. You're picking your client from a drop down, and if the client's not there, you have to reach out to the state and report who the client is so they can get them added. So they are that specific. And we have a couple like small like phlebotomist places at local clinics. They want to that level of detail. In the state of Washington, you have to break it down by county. So you have to give, every client you've serviced in that county, they're talking about number of shifts they've worked. They want the employees um, by name. I mean, there is a lot of detail. You have to present the pay rates and the bill rates. So most of these states are, what they're really looking to do right there is identify the margins, right? And make sure that those
Yeah.
margins are fair. So, there's
Are
a
you price
lot
gouging
involved.
our facilities?
That's right. So there's a lot involved in what you're reporting to the state. It's not something that you're going to be able to easily avoid for long.
Yeah. No, not for long, right? These are new requirements. So the states are just building out these processes the last 3 to 5 years. As they get more robust, they get more funding, they get more access to resources, they're going to be able to enforce these laws. And that's where it's going to become very difficult for firms that have not taken the time to get set up over the last 3 to 5 years to operate, because the state is going to start enforcing this more and more so.
Absolutely. I mean, we've already had multiple responses to reports that have been submitted where they've asked us to clarify certain pieces of information or provide additional information. We've had audits for Washington, Minnesota, Illinois, multiple audits in the state of Illinois already. So, and they're just the routine function. They're not triggered off of anything other than it's proof of how serious they're taking this. So even though it's a challenge, right? It's something that I think we just have to embrace and figure out how to work with it, because there's really not going to be much working around it.
Right. Exactly. Not much working around it.
No.
Yeah, and I would say the same goes for I think we're gonna see in the next couple of years is an increased scrutiny on cybersecurity and
Oh,
information
absolutely.
security.
Yeah.
That is part of, I think, some of the licenses is making sure you comply with HIPAA and all that stuff, but the cyber stuff is newer, and you're sort of seeing that come to fruition through the Change Healthcare attack and some of the other cyber attacks that have hit healthcare facilities in the last couple of months.
Yeah, no, you're right. So there was already a lot of attention on HIPAA and cyber simply because of the number of HIPAA breaches that occur through social media, right? So that's not unique to contingent staff.
Right.
That can
Nurses
happen with
taking
any
pictures of their
staff.
patient stuff and all
That's
that.
right. Right, and they're doing like selfies and posting them, not realizing that the patient monitor displays up in the background, and you can see names and things like that, right? So
Yes.
lots of risk there, right? But the cyber in particular, yes, the number and frequency of cyber attacks is increasing greatly. And to your point, the Change Healthcare was stolen credentials. So they were stolen employee credentials that allowed the hackers to access the system, and then once they were in, they were off and running, right? So, we have over the past 2 years seen a significant increase in the number of business associate agreements that we are asked to sign. So those are, for anybody who doesn't know, when you are contracting with a healthcare facility, they will often identify a contingent staffing firm as a business associate, and therefore you'll be asked to sign a business associate agreement where you're basically committing to certain requirements related to HIPAA and high tech. And you'll be asked to provide proof of certain insurance coverages, to your point, Colin, cyber being one of them, right? And having to meet certain levels. And we're seeing the levels of coverage for that insurance steadily climb as well, which just shows how seriously healthcare organizations are taking, the commitment from these healthcare staffing agencies to ensure that the staff they provide are going to have that coverage in the event of a breach. So,
Right. So if you're building a back office in healthcare, you're going to need cyber insurance most likely next 2 to 5 years. And it's going to have increasing levels. So you need to get the amount that you need, right? So I think, we've seen 3 to 5 million is typically the
yes,
ask. People settle for 1 or 2, but I've seen up to 10.
I was
So
going to say we've seen up to 10. Yep,
yeah,
that was
you want
recent.
to make sure you have the proper amount, and that's expensive insurance. Not going to lie, it is expensive. The other thing is you want to think about how are you gathering information, right? Because you can put your clients at risk through gathering information in the incorrect way. As an example, if you're doing onboarding via email, you are extremely exposed to violating HIPAA and sharing information, that you shouldn't be sharing. If hackers hack your email, super simple. Just get your email password and your username. They have access to all the stuff in your email. That's extremely common. So you want to make sure you're doing things like onboarding, credentialing, sharing of important information with your clients in a secure manner, preferably through like a software platform that is encrypted and secured. Like that's one thing to consider doing and getting set up when you're building your back office.
Yeah, absolutely. We see a lot of people, like we'll even have our larger healthcare clients say, oh, it's okay, send it through an encrypted email and then just send me the password. And it's like, well, hold on, time out. You just blew the whole process, right? Like it doesn't do any good. So encrypted email is an option, but it's a really clunky option if you're going to do it right. So yes, portals are the much better way to go. If you have a secure method of delivery that it's not email, that's always going to be your safer bet.
Yeah, and preferably multi-factor authentication is set up with those. So you have to do the text and you've got to get the code, or you've got to have an app. There's a lot there, right? So if you're thinking, oh, I'm
Yes.
just going to set up my healthcare staffing back office, like we want you to be successful, but there are so many things that you want to consider and make sure that you're protected and do so that you're operating your business in a way that can benefit your clients, but also not put you in jeopardy. And that's the biggest thing I think about building a healthcare back office is doing it right the first time so that you don't have to solve any problems later, at least not as many.
Right, right, absolutely. And you protect your reputation, right? You protect and build your reputation. In an industry that relies on compliance, we shouldn't be afraid to have those levels built into our processes. Clients are going to not just respect them, but appreciate them. That's actually what's going to help you stand out, not make you harder to work with.
Agreed. Agreed. 100%. So if you're looking to build your healthcare back office and you have questions, please reach out to us. Happy to have chats about it. Whether or not you want to use EOR services with Foxair does not matter. Happy to talk you through what we know. But if you thought this was valuable, please subscribe to the channel and we'll see you next time. Thanks.